in Nigeria vis-a-vis unemployment. Yes, it is true. There is shortage of nurses. One, because when most nurses are retiring, government is not replacing. It is diminishing the number of workforce. Two, some people are also depleting the number that is giving rise to shortage of nurses. Some other people, for one reason or the other, can leave for other reasons, either by change of profession or getting involved with agency and not interested in working the clinical area or things like that. So generally there is, yes, shortage of nurses. Even when you leave the clinical area and talk about the school, you hardly have adequate number of lecturers professionally qualified in the school. Though now a lot of people are coming up. We have professors, we have many PhD holders, masters, first degree. Many of them are there presently. Unlike before, they are there. So the next item is quackery. The other person that responded on behalf of the DNS has also made mention about what is being done about quackery. I am sure most of you there should know MCPDP. It's a committee set by the Nursing and Midwifery Council of Nigeria. And they have that responsibility to collaborate with NANNM leadership in the state to fight quackery. The Nursing and Midwifery Council of Nigeria on their own quackery. So the council is not taking it light. The NANNM is not taking it light. It is a fight that all of us need to join together. Like the presenter said, some of them are aided and abetted by us. What about if a doctor has a clinic somewhere in that River State and he enjoins you a nurse to give him maybe 1 or 2 people who will be coming in the evening to serve, he'll be paying you. And when you come, because you will be looking for either higher pay, they will bring people that are really jobless, whether secondary school or thereabout. It is that nurse that probably will train on what to do to assist the doctor there. Before you know it, when the nurse is not there, the person you have trained in quote will be doing what ordinarily you'll be expected to. As much as we're fighting it, some of us are also. There was an issue of, does nursing have standing order in Nigeria? We don't have standing order. What we have is job description. It is the shoe that have what you may regard as standing order. That one, the answer is very straightforward. So we have job description. And by extension, let me say this. I hope I'm being listened to. Hello?
Yes,
I hope you are getting me.
Yes, we can hear you.
Yes, sir.
Yes, sir, we can hear you.
Let me also emphasize from this area. I want to identify 2 things for NANNM and the other one for Nursing and Midwifery Council of Nigeria. Now, Nursing and Midwifery Council of Nigeria is a statutory registered regulatory body which is concerned with what? Education, training, certification of professional nurses and midwives who, after the exam, are now qualified to practice. They are registered and given license to practice. That is on the side of the Nursing and Midwifery Council of Nigeria. On the other hand, as a profession, in profession by extension, take note of this. Every profession that is core profession and is recognized are known for 4 items. These 4 items are not just limited to it, they are more than that. But these 4 items, I want you to meditate over it. Every profession must have that regulatory body, which is concerned with education, registration, and practice. Every profession should have a professional body like NANNM. Every profession has code of ethics. That's number 3. Nursing has it. Every other core profession has it. Number 4 is autonomy. Every profession has to be autonomous, and part of autonomy has to do with the profession producing itself and being in control of every activity of itself. I want you to examine whether we have all these 4 criteria. If we have it, look at whether there are limitations, operations, or full-fledged, whatever. Now, apart from the Nursing and Midwifery Council of Nigeria, which is a statutory registered established regulatory body, NANNM on their part is also concerned with what? Standard of practice and the conditions of service of those professional nurses that are working. I want you to look at the 2, because sometimes some of the nurses do not know specifically what NANNM does, what the council does. Sometimes it is mixed up. Sometimes some will get it, some will not get it. So having explained the key roles of both the Nursing and Midwifery Council of Nigeria and that of NANNM, which is a professional trade union organization concerned about what? Bringing the members of the profession together, discussing on how to improve standard, discussing on how to improve conditions of service, especially for those that are qualified to be members. Now, by the rules of these professional colleagues, they now work according to the provision of the job description, which is also entrenched in the scheme of service. So anybody that is not very clear about the level of operation should make a consultation to the scheme of service. Everything is well specified.
I can't hear you, sir. We seem to have lost you, sir.
Fine. Then some that when they are in the world, they are, that chatting you do. Hello? Hello?
Yeah.
Are we together?
Yes, we can hear you now. We can hear you, sir.
Okay. Maybe I'll fast track the whole thing. Somebody talked about a chatting. The chatting I say is documentation, because the nurse you need to document. Documenting even the medication, documenting even anything you have done, dressing or whatever. And then taking of vital signs is also requires that documentation, because it has to do with time and the correctness of what you are doing. And the relevance has to be documented. That is why it appears as if the nurses write a lot. I don't think somebody should be discouraged about writing. I hope we need to know that it's also part of us. Then somebody that talked about vital signs, that is anybody can do. Anybody cannot do that. If you can tell yourself the truth, before you were able to read a thermometer, somebody taught you what to do. If you are sincere, you will echo yes. As a nurse educator, during that PTS, if we ask them to read it, hardly do they read it, until we identify and tell them that there is something you look at it that is transparent, and that is the mercury level. If you don't identify that mercury level, you hardly know what you are reading. This is a fact, and that is where the nurse is distinguished from any other person. Somebody talked about skills. Skills is nothing other than the competence in the practice. You have acquired the knowledge, have you acquired the skill? If you have the skill, you can do it and do it with competence. So, in summary, vital science is not as easy as anything. Nobody can take vital science correctly except that nurse who is trained. If you look at the temperature, there are characteristics of temperature you need to know. There are sites. You talk about pulse. There are sites for pulse, shaking pulse. If you don't know it, how can everybody do it? Respiration. If you don't know regularity, rhythm, the qualities, how can you do that? It is not merely go and maybe document it or shake it. If you shake it and you don't have blood pressure, if you don't know the cubital vessel, you don't
Hello, we seem to have lost.
recent memos. Are we in order? Are we together? Are we?
Yes, we can hear you, sir. Yes, we can hear you.
Hello? Okay. Recent memos. The recent memos that we are working on it. They're receiving a meeting coming up on Monday, whereby the nurses, pharmacy, lab, and other groups are coming together. We have had a small Zoom meeting on that. And then by the time we meet, we now present our positions. Anything we are doing with the group, NANNM has their own position, please take note of that. It is true that sometimes people may not know what we have done unless we discuss at this certain level. And that is why this interaction is necessary, because if you don't know, you are bound to ask questions. So we are not folding our hands, because if you look at that document, you see that even the doctors are affected. There are two documents. One is on internship. The other one is entry point into the scheme of service. The other one that is talking about not using professionals. I don't know whether I have seen that one. No. Not using professionals for employment. But even though the circular letter said for now, at the interim, they will be using it. However, the other one is actually giving our certificate academic relevance. And if you look at what is listed, you will notice that all those areas have academic relevance. They are looking at the other professional area, which is being regulated by the professional group. The medical doctors are affected in this area. So the summary and response in that is that we are not folding our hands. All this while we'll be talking about proper placement of interns, proper placement of nurse graduates, and the rest of it. It has become an issue that if we are sincere, you know that almost every other day it comes up. So possibly government now feels that the disturbance is much. I don't know who is sponsoring that, but take note that we are not folding our hands. Career progression and hope for the profession. Please, I tell you there is hope. And on this ground, I will expect that when you graduate, instead of settling, make effort to acquire masters, PhD. It is true that once you get the basic, you'll be looking for a job because you want to settle down, either as a young lady or a man, whatever way. So the education is better. Look at areas of specialization. If you specialize, you become more relevant because at any point you may be needed. It is also important for me to inform you that the Nursing and Midwifery Council of Nigeria has upgraded almost all you used to call post-basic to degree. yes, there may be no adequate lecturers for this, but it is a way forward which the digital registrar has always been working hard to ensure that a profession is moving. Anybody that knows how the council used to be will tell you that the current registrar is doing so well. That is why we call him digital registrar. So career progression, there is hope in nursing. Clinical skill is important. Then NANNM and the Nursing and Midwifery Council of Nigeria is not keeping quiet over any issue that is relevant in nursing. Please do not be deceived by anybody telling you they are not doing anything. It is not true. Sometimes it is only what will begin to benefit immediately that we believe that something has been done. Even though majority of people do not even believe that what they enjoy is negotiated or struggled for by the association. Many people do not know what the association is doing. And that is why most often it's labeled, they are not doing this, they are not doing that. Please, the association is working hard to ensure that whatever the benefit that the nurses have to get, that all those things are derived. And the government, you don't get anything just like that. You have to make case, you have to negotiate, you have to ask. Is it not Bible that says that ask for it shall be given? What about if you don't ask? I will leave you where you are. So having said this, I want to advise on 2 areas. Let's see how we can improve in our attitude, that is behavior, looking at code of ethics, and then trying to do the right thing always, whether in the clinical area, whether at home, whether anywhere you find yourself. Try as much as possible to be disciplined. Let me use that word, be disciplined. If 1, 2, 3, 4 are disciplined, the society may look at other members as being disciplined. And depending on the attitude, the nursing profession will be described along that side. That is where it touches on the image. Second area of advice is the way we approach issues. Let us approach issues maturely and then using the procedure to approach issues, either asking for clarification or as the case may be. So these are the little I want to make available to us, believing that our listeners are getting this. However, I'm still available in case there's anything you need further